Welcome everyone to Coaching Conversations with the Executive Coaches Orange County. My name is Ernest Stambouli and I am the chair at ECofOC. Coaching Conversations is a direct response to pressing issues and questions that we hear from our clients. ECofOC is a nonprofit organization that offers no-cost leadership and management development to nonprofits in Orange County, and our mission is to help nonprofits fulfill more of their mission. We have about 60 plus coaches, and they're all committed to listen and offer the best coaching in helping you, the philanthropic leaders, to take purposeful action in these challenging times. Our speaker today is Audrianne Adams Lee. She is the president and founder of HR Network, Inc. Audrianne brings 30 years of human resources experience and expertise from Fortune 500 high-tech and service companies. That includes companies like Marriott, ADP, Epson, and Western Digital. Audrianne brings hands-on experience in putting together HR leadership and management training programs that help organizations define leadership role clarification towards increased performance. Her company is an HR outsourcing service that partners with businesses to relieve them from the burden and confusion of the complicated and highly regulated human resources system. So today, Audrianne, is going to offer you a full and pragmatic outlook on a wide range of challenges that face employers that now are open for business. And the question is, now what? We think this is an important talk, and we are going to spend more time than we usually do in coaching conversations. So please be prepared to spend 90 minutes in this webinar. Here's how to participate. All webinar attendees are going to be in view and listen only mode. So please take a moment to locate and open the Q&A window in Zoom. And during the talk, at any time, type in your question in the Q&A window. You can also use the chat box as well. At the end of the talk, Audrianne will take your questions and I will read them to everyone, and we will work on answering as many as we have time for. And this webinar is being recorded. With that, Audrianne, thank you for doing this. You have the floor.
Thank you, Ernest, and welcome to everyone who's joined us today. So I understand that you spoke recently about, in a recent conversation with one of my colleagues, you talked about COVID and how it's affecting, impacting business. We're going to talk a little bit today about getting people back to work and what that looks like and what happens when they return to work. We also have added some extra topics because we're seeing that a lot of employers are dealing with a myriad of different things right now. So we're going to talk about some other current topics as well. So let's get started. Okay, so we look at where are we at in the reopening phases in California. We have stage 1, stage 2, stage 3, stage 4. If you look on the California website, it says that we are actually in stage 2, but we really have opened up some of the businesses in stage 3, the higher risk businesses, including salons and barbershops. I know they talked about, if they haven't already, nail salons, gyms, and movie theaters have opened with restrictions. Could we go back down to stage 2 or even stage 1? Possibly. Our numbers are really going up dramatically over the last 48 hours. So hard to say, but these are the phases that we're working through in California. Okay, so there are going to be some challenges as employers return to work, and some of those challenges might have to be to restructure the way they were doing business, and that could look very differently than when employees left. We're suggesting to employers that they really develop an 18-month strategy. They're saying that we're probably going to be in this, what we're doing right now, for at least a year, which sounds a little disheartening, I know, but we are going to have to figure out how do we get through this until there is either a vaccine or some way of treating the virus. a respond, return, and reinvent model is going to be really helpful. It's going to look different for each employer. And some employers may stop and start, may do a gradual return, but like I said, it's probably going to look pretty different than when employees first left. Okay, so how do we decide who returns to work and who doesn't return to work? So a few words of caution, especially from an HR perspective. You want to make sure that any recall that you are doing of laid off or furloughed employees, that you are not necessarily discriminating against any protected group of employees. Who, for example, people have said to me, well, I'm not going to bring older workers back because they're higher risk, or pregnant employees, they're higher risk. And the reality is actually you can't choose to bring people back based on their age, and pregnancy isn't really considered a disability until at a time when the woman's actually giving birth. So just the fact of being pregnant in itself. If somebody provides you information that says they are at risk, there may be other issues, but just the fact that they're older or pregnant doesn't preclude them from being included with anybody else. So you got to be really careful about your rehiring practices. Make sure that they aren't discriminatory. Also in LA County, there's a right to recall order. So if you are an employer in LA County or have employees in LA County, you have to follow the right to recall order. It's very, very strict. So we're not going to get into that today, but that might be something to look into if it affects you. Part of the issue is going to be employee availability. So you're going to have to gauge their willingness and ability to return to work. I was just on the phone this morning with an employee who does not want to come back to work, wants to continue working remotely, but not willing to come back to the office. And so those might be issues you have to deal with. Especially they might reside in a locality where it's subject to certain restrictions, like LA may have restrictions that Orange County doesn't. They may have temporarily relocated their residents. They could have, moved to mom and dad's house in Phoenix temporarily while they were quarantining. And they may end up have had caregiver obligations as a result of COVID-19. So there's a lot of things employers may have to deal with when they start looking at who's coming back to work and who's not. Okay, so as you're returning people back to work, one of the concerns is, what do I have to re-implement? And part of it depends on if you laid them off or if you furloughed them. So if you laid them off, that meant you ended their employment with you, you paid out their vacation, they're no longer on your payroll, versus if you furloughed them, you just no longer provided them with any hours. So if you furloughed them, bringing them back, you're just reinstating them. There's no issue there. There's nothing to do. But if you laid them off, you may have to complete a new I-9. As long as you hired an employee within 3 years, though, you can continue to use the I-9 that you previously had on them, or you can choose to complete a new one. But whatever you do, you have to make sure that you do for one, that you do for all. You have to do the same thing. And as a reminder, on May 1, a new I-9 form came in, is effective. And so you as all employers need to be using the current I-9 form, not just not the old I-9 form, if you're completing new ones. Okay, paid sick leave. So if you laid employees off and you paid out their vacation, you did not pay out their paid sick leave accrual because you're not required to. However, under the California paid sick leave law, if employees return within 1 year, if they're rehired within 1 year, whatever they had in their sick leave bank has to be paid back out again. It has to be re-implemented. So let's say I left the company 3 months ago. I had 2 of my 3 days of paid sick leave left that I didn't use. You're bringing me back now. You'd have to put those 2 days of paid sick leave back in my sick leave bank and then allow me to start accruing back up to the 3 days again. Okay, what about background checks and drug tests? So typically this is going to be based on your business model, and or any requirements you have. Some nonprofits, especially those working with children and or in healthcare, may have to do a new drug test because that's part of the requirement of your business, of any grants that you may have, etc. So you have to look at that. If it's not a requirement, then you're going to decide if you feel like you want to continue to do background checks again and or drug tests. Okay, and you may have some new policies now, especially if you're going to do things like temperature check, cross-training, social distancing. Whatever your new policies are, you want to make sure that you put those in writing and provide them to employees and that they sign off on those new policies. Okay, so if you look at the slide on the top right corner, you're going to see a hierarchy of controls. This is from the CDC. And the more that you put in place when it comes to controls in the workplace, the safer it's going to be. So obviously, the bare minimum is PPE, all the way up to things you may put into place to try to eliminate any potential virus and or infection. So what should employers do? Well, screening employees and visitors when they come into the building. And we have a lot of clients that are doing this. They are doing temperature checks, they're doing health screening forms, etc. But one thing to note is that if taking this time to do this, it takes a few minutes for a temperature check, it takes 5 minutes to fill in the health screening form, somebody is actually putting that all together. And then checking all that and saying, okay, you're cleared to go in. That takes, let's say, 10 minutes. If you're a non-exempt or hourly employee, that time has to be paid, but they haven't really punched in yet. So you've got to be careful about that. We call that donning and doffing when it comes to wage and hour in California. So you've got to add that to the time card. Same with any post activities that they may have. Making sure that you're cleaning common areas and frequently touched surfaces, providing hand sanitizer, displaying posters around your facility on how to prevent the spread of germs. You may want to modify business hours or stagger workplaces. So especially, let's say I have 30 employees that all start at 8 o'clock, but I'm temperature screening and I'm doing health screenings. If I were to have everybody show up at 8 o'clock, I'm going to have a big backlog of people getting in the door while I'm getting these temperature checks and health screenings done. So you might want to start staggering people to come in 5 minutes apart, up to a half an hour before, half an hour after, because you also don't want everybody entering the building at the same time, all close together, hitting the time clock, putting their food in the refrigerator, etc. You may need to revise your workspace layouts and seating arrangements, changing up your meeting rooms and break rooms so that you can social distance. You may want to mark hallways and stairways so you don't have face-to-face traffic. Traffic is kind of all going in one direction. And then, of course, restricting any business travel that remains essential only. Okay, so that was what employers should do. Let's talk about what employees should do. First and foremost, we want to remind employees to stay home if they are sick. We just don't want employees coming in. And we've heard from employees that say, I'm afraid I'm going to lose my job if I don't come in. I'm afraid I won't get paid. So I'm just coming in anyway. But we really need to emphasize and work with employees to not come in if they aren't feeling well, even if it's not COVID related, because right now we don't want anybody that's sick in the workplace. To maintain their social distancing, following their cleaning protocols, wash their hands frequently, cover their nose and mouth when sneezing and coughing. I think it's OSHA, either Cal OSHA or the CDC has even put out a training module on sneezing and coughing etiquette. So if that's something you want to provide your employees, that module's out there. Avoid touching your face. Wear a face covering. Right now in Orange County, we're back to being required to wear a face covering in public and in our workplaces, especially where social distancing cannot be met. Replacing handshakes with nods and waves. Avoid using other employees' tools, equipment, their phones, their desks, etc. And then mostly be kind and understanding this is a really stressful time for everybody, and a little bit of kindness can go a long way right now. We're going to talk about kind of mentality, attitude, and stress towards the end of our webinar today. Okay, so one of the things that we put together is frequently asked questions that you're probably going to get from a lot of people as they're returning to the workplace. We want to talk about how to respond to those questions. I would say number one is, I don't want to come back to work. I'm fearful to come back to work. I like working from home. I've figured, I've got good routine down. I just want to keep working from home. And that can be a problem because, for example, I told you that earlier this morning, and the employers were wanting everybody to come back to the workplace now, and no longer going to continue to give employees the opportunity to telecommute. The employees are really giving that employer some pushback. So, you have to tell employees we expect everyone at our business location, unless there's a legitimate reason for continued telework, such as an employee with a compromised immune system or caregiver responsibilities. And there are potential reasons why legitimate reasons why a person may not be able to come back to work. And they may qualify for things like FFCRA pay, et cetera, or other legal rights, which I'm going to talk about in a bit. But each person, that's individually going to be worked out, and you're going to have to figure that out on a one-by-one basis. One thing employees really want to know is it safe to return to work? And the answer is, you're going to tell them we're taking every precaution to ensure our workplace is safe, following all the federal and state guidelines for safety, implementing practices such as, and you identify those practices that you're implementing. As a matter of fact, we suggest when you do your return to work letter, okay, everybody, we're ready to reopen. We'd like everybody to report back on this date, that you identify and list all those things that you're doing to create a safe workplace as well. Okay, what if I can't get to work? I know mass transit was on they weren't on a full operational schedule. I think they're back to that now, but that could come and go again, depending on how things go with our numbers, and if we end up going backwards in our reopening as opposed to forward. So again, people may have problems with transportation, and that's something you have to try to work out with your employees. They might want to know, how does the staggered shift work for me? And you're going to explain why you're having staggered shifts, and you don't want everybody showing up at the same time and getting coffee and being in the elevator at the same time. And so that's why you've set up these staggered shifts. Do I have to answer medical questions when reporting to work? Some people aren't that comfortable with having their temperature taken. They're not that comfortable with answering the screening questionnaires, but the answer is, when it's related to COVID-19, the EEOC and other agencies have said you have a right to ask those medical questions. So we do have a right to ask medical questions related to COVID-19 around the symptoms that they may have, taking their temperatures. And if employees refuse to either submit to a temperature check or to answer the health screening form, you can tell them they're not allowed entry into the building. So you would mark it as an unexcused absence, and they may be subject to disciplinary action. Before you get to that point, though, I always say, try to talk to employees, try to get to the bottom of what their fears are, and see if you can't try to work through that with them. What do I do if I feel sick? Well, we, again, need to emphasize to employees that if you feel sick, notify your manager. We want you to go home. We'll figure out how you get paid, or if there's pay available, but do not come to work if you're not feeling well. Okay, do I have to wear a mask at work? Well, first of all, right now it's being required by both county and state order. When it's lifted from either county or state order, you can choose if people wear a mask or not as an employer. We do recommend that you continue to have people wear masks. It's not that comfortable right now, but it does prevent the spread of the virus. So from that perspective, it's very important. But again, if somebody has a medical condition that may restrict them from wearing one, then you have to see how you accommodate them, how you make sure that they're kept in a separate area where they can properly social distance with other people. Will we continue to have in-person meetings? And depending on your situation, you may or may not. You know, we work with a lot of small businesses who just aren't, they don't have the space to be able to continue to have meetings and be able to social distance. So I have a lot of clients who are actually using Zoom, even though people are back to work. Right within their own building and office, they're using Zoom so people don't have to congregate together. So you have to decide on that as well. Okay, how will positive cases of COVID be handled in the workplace? And we're actually going to talk about directly how to handle positive cases of COVID, but you'll reassure employees that that if anyone is tested positive, you will let them know, and if they've been exposed to it, they may be sent home, maybe have the opportunity to telework, if not, at least self-quarantine. So we're going to talk specifically about how you handle COVID-19 positive cases. And I, as an HR company, we probably went almost 2 months, and in 2 months, the first 2 months only had 1 positive case. We are now dealing with anywhere from 1 to 4 positive cases a day within our clients. So we can definitely see it's on the rise. What about the health insurance premiums that I missed while I was not working? So if you furloughed your employees, a lot of companies, what they did was they just paid the full health insurance paid because employees weren't getting a paycheck, right? So what they did is that they paid the employees portion as well as the companies and said, we'll worry about that later. You can get that money back from employees. However, be very careful on a few things. One, you can never take a non-standard deduction, and at this point it is a non-standard deduction because it's not the standard week to week to week deduction you would take from an employee that they've already approved. You can never take somebody below minimum wage with a non-standard deduction, and so you have to be very careful about that. You can't necessarily take a lump sum payroll deduction, so you may have to spread those deductions out over a period of time for the employee to repay what they owe. And if you do that, make sure that you have the employee sign off on a deduction, an authorization to deduct it out of their paycheck. I do know, though, that a lot of employers, especially those that got the PPP, are saying, you know what, we're just going to cover it under our PPP, and they aren't having employees pay it back. So you need to decide about that before employees return. Okay, so what happens if I have employees who don't want to return? And they may not want to for a variety of reasons, right? First is I don't have childcare. My children are at home and I have nowhere. Schools are closed, schools are closed, and I don't have anywhere for them to go. So they may qualify for FFCRA. I'm going to get into that a little separately in a bit. They may have, if you can, give them remote work when possible, and that eliminates the need for you to have to pay them the FFCRA. They may be unable to return. They consider they're high risk and may have some kind of medical disability, and in that case, you may have to you may have a duty to engage in the interactive process. Or the employee's just fearful to return. I'm afraid to return. I had a situation last week where an employee tested positive, and immediately 3 employees left the workplace and said, I'm afraid to be here because I was around that person and I'm afraid I'm going to get sick. Be very careful about taking any adverse action against an employee who is fearful. Why? Because employees actually have a couple of areas of legal rights when it comes to being concerned about an unsafe workplace. For example, OSHA has what's called a duty, forgetting the technical term of it, but essentially everyone has a right to come to a workplace they feel safe at. And if at any time they feel like the workplace could cause them harm, illness, injury, or even death, they do not have to come to work, nor do they have to fear what would happen to them for not coming to work for those reasons, right? The NLRA, National Labor Relations Act, says you can't take adverse action against employees who may take collective action out of workplace conditions. So for example, those 3 employees I talked about who walked out the workplace because they were fearful, if the employer had taken adverse action against them for doing that, they could have filed a claim under the National Labor Relations Act. And that would not have been something that the employer would have wanted to deal with. So be very careful about that. I suggest that, you know, as best you can, communicate with employees and have them and try to work through their fears and concerns. Okay, let's talk about the FFCRA. And that is, I spoke about it earlier. So the FFCRA is the paid sick leave. There's also a segment of it called paid family leave, emergency paid family leave. Under the paid sick leave, there are 6 reasons which you may have to pay somebody this emergency paid sick leave. 1, they're subject to federal quarantine. 2, they've been advised by a healthcare provider to self-quarantine. Or they're getting, number 3, they're getting a medical diagnosis. They're getting tested because they have symptoms of COVID. 4, they're caring for an individual from above, either somebody who's required to quarantine, been advised by a healthcare provider to quarantine, or getting tested for COVID-19. Number 5, because their child care or school has been closed and they have no child care available. And number 6, they are experiencing substantially similar conditions as specified by the Secretary of Health and Human Services, which unfortunately to date, the Secretary of Health and Human Services still hasn't given us what substantially similar conditions are. Why do I have 2, 3, and 4 highlighted? Because about 90% of the time, these are going to be the issues you're dealing with right now, are people who are showing up potentially positive or have symptoms of COVID. All right, so let's talk about what happens. How do you pay people for these? For the emergency paid sick leave, an employee gets up to 80 hours or 2 weeks of paid sick leave. For reasons 1 to 3, it's 100% of regular rate of pay. For reasons 4 through 6, it's 2/3 the regular rate of pay. So let's go back. That's why we have a line between 1 to 3 and 4 to 6. So 1 to 3, 100% of pay. 4 to 6, 2/3 of pay. And this is something you'd have to have set up, or you need to get set up with your payroll provider. Most big payroll companies do have this set up already, because you need to track this in different buckets of pay in order to get reimbursed for it. And I'm going to talk about how to get reimbursed in a second. And then the emergency paid family leave is up to 10 weeks of emergency paid family leave at 2/3 the employee's regular rate of pay, paid by the employer, but it is for reason number 5 only. And remember, number 5 is the employee's child school has either been closed or is not available, or their child care is not available. So again, that's up to 10 weeks of paid family leave. Well, what about employees didn't the school year just end, or isn't it ending now? So if the school year ended, does that mean that they're no longer eligible for FFCRA? And then maybe, right? In HR, a lot of things are maybes. So in this case, even though the school may have closed, parents typically make other arrangements in the summertime for child care provisions for their children, but those child care provisions may not be available to them, whether it be a child care provider, a before and after school program, a summer camp, etc. So if those provisions are not available to employees after school has closed, then they would still be eligible for the FFCRA. Now, be careful on this, because you can't ask for too much information. You can request that they show you that the school or the daycare is closed or not available. When it comes to camp and summer activities, though, you can't ask for enrollment records and confidential information about the child. All right, so what kind of documentation do you need for this FFCRA? First of all, on the right-hand side, you'll see a poster that's there called Employee Rights. And when this first came out and became a law, you were required to post this poster. So if you have not posted this poster, you can go out on Google, type FFCRA poster, you're gonna see this come up. You either can download it, it's a PDF, you can download it and print it and put it on your bulletin board if you're back to work. Or if you have employees working remotely, then we suggest you email it to them, because you are required to notify everyone, all your employees, of their FFCRA rights. As far as documentation goes, so because you're going to get a credit from the IRS on your FFCRA, you need to provide them, you need to show them the employee's name, the dates that leave were requested, the qualifying reason for the leave, either an oral or written statement from the employee that they're unable to work, and which of the one of the 6 reasons why not. I don't suggest you do oral. Of course, for an HR, everything should be in writing. And actually, it would be good to have a form. That form is going to go in with your payroll, in a payroll file, should you get audited down the road. So you want to be able to show that information should you get audited. Okay, so how do I get reimbursed for this? I can't afford to pay this. My goodness, we're a nonprofit. We don't have those kinds of funds. There is a small business exception if you're under 25 employees, and you can go out and look at the small business exception. The reimbursement for this is actually against quarterly payroll taxes. So your payroll company is going to set this up to take this against your 941 quarterly payroll taxes. Well, again, nonprofits don't necessarily have those taxes. But there is a form for nonprofits to fill out, and there is a form for to be able to get a reimbursement. Here's some links and instructions, and you can actually go out and do that through the IRS and get an immediate advance payment towards the monies you're paying. Okay, let's talk about what happens if an employee tests positive. And like I said, we're getting more and more of these every day. So you should follow a timeline for responding to COVID-19 infection. I have a timeline that we've created, and I'm happy to share it with this group. And it really goes through, like, what do you do in the first hour, first 2 hours, half day, full day, second day, first week, etc. First and foremost, get that employee out of the building as soon as you learn of it. But quite honestly, very rarely are you going to learn that somebody's COVID positive while they're still working in the building. The reality is that most people either call in sick because they're not feeling well, go home sick because they're not feeling well, and then the doctor says take a COVID test. They might do that the next day or even the day after that, and then it takes 2 to 3 days at best to get the results. So quite often, you might not even learn somebody's COVID positive until they've been gone from the workplace for a week, which is unfortunate, because at that point we are unable to have responded as quickly as we want to where they may have been, and doing the contact tracing and the cleaning that we do if we had known they were positive. So I do suggest that anytime somebody goes home feeling sick, treat it like it's a positive case. Do your contact tracing and your cleaning and disinfecting protocols. It won't hurt anything, and that way then if you do find out they've been positive, you've actually made the workplace safe and probably prevented the spread that has occurred because that person was in the workplace. You do need to prepare communication to your employees. You can provide an email or a letter to them letting them know somebody has tested positive in the workplace. You are not allowed to identify that employee by name unless the employee gives you the authorization to do so. So you would just say a staff member has been tested positive, and here's all the steps we're taking to address it. If you have 20 employees and one went home for 2 weeks, it's probably pretty obvious who that staff member was, but you just can't share that name or that information. Okay. Should an employee with COVID-19 symptoms or a positive test stay home before returning to work? Well, there's two strategies you can follow. One is symptom-based only, meaning they don't get a test. We were really following this early on because tests weren't available. They're more readily available now. However, if somebody doesn't go get a test, then you would have them continue to self-isolate until at least 3 days or 72 hours has passed since the recovery of no fever without using medication, no respiratory symptoms, and 10 days have passed since their symptoms first appeared. If they did get a test, then your strategy is they can just continue isolation. Again, resolution of fever without fever reducing medications, improvement in respiratory symptoms, and a negative FDA approved COVID-19 test. Now, one thing I'll share with you is even though tests are more readily available, they're not necessarily always available. And so I'm finding that some doctors and facilities are actually not doing second tests. They're telling employees or telling people to follow the symptom-based strategy because they just don't have enough tests to do a second test on someone. So your employee may not be able to get a second test if they tested positive, and you may just have to follow the symptom-based strategy. Okay, we do have some resources available, and like I said, I'll be happy to share them with you. So we have a checklist of what to do if you have a positive case, a sample notice you can provide to employees. We've created an SOP of all the things you could consider returning to work, and a sample employee health screening form. So I will provide those to Ernest, and Ernest can send those out after the seminar is completed. Okay, let's talk about contact tracing for a minute. This has become, as we've learned, very, very critical to try to minimize the spread of infection. So COVID-19 exposure risk begins when somebody is within 6 feet of an infected person for 15 minutes or more. And actually infected people can spread the virus 48 hours before they even feel any symptoms. And actually, we've learned that sometimes we can have symptoms anywhere from 3 days to 14 days before we even know we test positive. So you need to look at who's been in contact with that infected person or in close contact or shared spaces. And that gets difficult, right? Because especially if we're a small business, if we are sharing the lunchroom, the restroom, the refrigerator. So again, these are all shared spaces that you really want to take a look at and try to minimize as much as you can. You want to send any employees home who've had a risk of exposure and advise them to social distance and self-monitor for 14 days. If possible, and you can do remote work, that would be the best thing you can do. However, the CDC has said that exposed employees in an essential business can continue to work on site while self-monitoring as long as they wear a face mask. They have not put anything out regarding non-essential businesses. I would say if you are a non-essential business and you've been allowed to reopen, could you follow the same guidelines? We think so, right? We think that as long as that person wears masks, they continue to social distance, they follow all the safety protocols, that it's okay to continue working, provided they don't show any symptoms. Keep some kind of record keeping of your contact tracing efforts, but again, this is something that needs to be confidential and separate. And you're also, on one of the resources is to contact the state health department. They're actually helping employers with contact tracing, and they're tracking it. They're actually putting it in a database as well to help contact trace as well. Okay. What happens if an employee's family tests positive? So an employee may come to you and say, hey boss, I don't think I can come to work because somebody in my family has tested positive. And again, as long as the person is asymptomatic and all the right protective measures are taken, they're wearing a mask, you're disinfecting the areas, again, the CDC has said For essential employees, as long as they are not showing any symptoms, they can continue to wear, and they wear a mask, they can continue to work. So that's something you'd have to decide as an employer what you feel comfortable and safe with. I will say, though, that when employees find this out, they're often uncomfortable. So that is something you may have to address and deal with. Okay, what about employees travel and vacation? It's summertime, things are starting to open up, employees are kind of getting a little stir crazy, they want to go on vacation. I'm worried about them maybe traveling somewhere and then coming back and potentially bringing COVID back to the workplace with them. Can you ask employees about their personal travel history and future travel plans? And the answer is yes, you can, but be consistent. Don't ask ask this person because you think they're less responsible than this person over here. So be consistent about what you ask, and it needs to have a business necessity to it in order to potentially avoid discrimination claims. Can I prohibit employees from traveling to non-restricted areas for personal reasons? And the answer is no, you cannot. We're very limited about what we can do about employees' conduct outside of work. So that's not something we can really do anything about. Can you require them to self-quarantine for 14 days returning from a vacation? Well, you absolutely should require that if they went to a CDC level 3 country or kind of hot zone, as they call them, or any high risk areas. And if they didn't go to necessarily a high risk area, which by the way, we're considered one now, right? There's other states preventing us from going to their state. But you could, if you feel that you are worried about the risk of them coming back into the business. The problem is, again, employees are going to say, hey, wait a minute, I can't afford to be off work for 2 weeks. How do I get paid for this? And there may be different ways of getting paid for it, but we're going to talk about those different ideas in a minute. Okay, another problem that employers are running up against is we've all been home for months and months and months at this point. Nobody's taking time off, nobody's taking any vacation. So what's happening is vacation bank accounts are hitting the caps, right? In California, we can't have a use it or lose it. Our minimum requirement when we accrue vacation is it rolls over to 1.5 times what they're annually entitled to. So people are starting to hit that cap. For example, if I get 2 weeks a year, at my rollover would be 1.5 times that, or 3 weeks. So I can't take, once I hit that 3 weeks, until I get it below the cap of 3 weeks, I don't accrue any more time. Well, if I'm one of those people because of COVID that I've hit the cap, I might not be too happy about that because it wasn't my fault, anything I did, right? But yeah, I'm going to lose vacation now. So employers are getting a little creative around this issue. So here are some ideas that they've come up with. One, requiring employees to take every Friday off as vacation for the next couple of months. 2, requiring 1 week of staggered staycations. Okay, we want employees to actually take a week off, no emails, no phone calls, go and enjoy your family. Increasing the accrual cap. So instead of 1.5 times, I might increase it to 2 times. But just be aware, anything that's accrued in an employee's bank is a liability to the company. And if they leave, you of course have to pay anything that's in their bank, anything that they've already accrued. And then some companies are doing a payout at the end of the year of 1 week of vacation. There's a new plan, a new type of plan that's gaining some interest in California, and that's called unlimited vacation time. That sounds interesting. What's that mean? That's actually where you say to employees, hey, we're not going to count vacation. We're not going to accrue it. We're not going to count it. You're just going to take time off when you need it. And there's no number of days that go into your bank because we just don't count vacation. For some employers, that could be really, really scary, right? But for a professional environment where, let's say you have employees who have good longevity, a lot of seniority, professional environment, they tend to really be pretty focused on their work. This might be a good way of doing it because in this type of arrangement, you do not have to pay out vacation when they leave because you didn't count it, you didn't accrue it. And you'd still have a right, if you did something like this, to have blackout periods, to limit who can be gone at any one time, to limit how much time one can take at a, no more than 2 weeks at a time, etc. Anything you do to your vacation, any changes you make, you need to make sure that you put it in writing because it is a change from what your handbook may say or your current practices. So make sure to put it in writing. Okay. What do I do about employees who aren't socially distancing off duty? We've certainly seen a lot of people who have been in the streets protesting. Maybe we found out an employee went to a bar this weekend, and so we're worried about they're not using safe work practices outside of work, and they could bring it back into work. Can I do anything about that? And the answer is, again, you can't control off-duty behavior of your employees. So all you can really do is try to focus on what they do coming back to the workplace, meaning implement your safety practices, your daily health survey. Ask employees to monitor themselves and report any symptoms. If you're not taking temperatures, ask them to take temperatures. Try to educate employees about the impact of their behaviors and others, and ask them to behave responsibly. If you become aware that employees experiencing symptoms, have them leave, go get tested, isolate if need be, and beware of speculation. Don't be perusing employees' Facebook posts to see if they're quarantining or if they're out and about. As employers, we're not allowed to do that. You can require an employee to get tested if you have legitimate reason to be concerned about an employee who may be experiencing symptoms or have a positive case. Okay, telecommute. So telecommuting, lots of employers started it, still doing it, might continue to do it. It has upsides and downsides, right? It eliminates time and money for the employees. It eliminates their commute costs. It increases job satisfaction. Employees say they really like it. It does create a little bit of professional isolation, impact on their well-being, and maybe even on their career development, right? Because they're not physically here to be seen at this point. For employers, telecommuting can reduce office costs. You might not need that big office anymore, but managing the staff can be difficult. So there's kind of upsides and downsides, right? If you're going to continue telecommuting, though, you should do a couple of things. You should have a telecommuting policy in place and an employment agreement. You have to make sure that they treat their home office like it was the office here and that they maintain a safe workplace. If they're hourly employees, they still need to manage their meal periods and breaks, just like if they were at the office. And you may owe them for equipment, any costs that they incur, and reimbursements. And then the other thing to be careful about that a lot of employers haven't thought of is cybersecurity, because now you've got employees using home internet, equipment at home, who may be getting into your technology, and so are you opening yourself up in that way as well? So those are all things to think about when it comes to telecommuting. I have an itch on my face and I don't want to scratch it, so I'm going to use my roller. Okay. So 10 tips for successfully managing remote workers. Set expectations early and often. Be organized and be flexible. I tell my employees, first of all, we're all telecommuting. I happen to be in my office today because I'm here doing this webinar, but my team is all telecommuting and has been since the stay-at-home orders. Every morning we have a Zoom meeting to connect with each other. Sometimes we have things to review and go over, and sometimes we don't, but it keeps us connected every day. And I've also told my employees at this point, I don't expect everyone to be sitting at home in front of a computer for 8 straight hours and not getting up and taking a break. I want them to get up and take breaks. I want them to, if they want to exercise in the middle of the day, so create some flexibility in there. I be able to track your workers' progress, really emphasize communication. That's so important. Listen to your employees. And while I thought my employees would love telecommuting, and we've done it kind of off and on even before COVID, but I had one employee who just was not comfortable with telecommuting and really struggled with it in the beginning. She likes it now, but it took her a while to kind of get into the swing of things. And so we just really spent some time talking about what her concerns were and trying to address those. Build connections and be available to your team. Find a way to collaborate and celebrate, by the way. I surprised my employees, as an example, a couple weeks ago and sent everybody on Friday afternoon at 4 o'clock. I had through one of those DoorDash kind of things, I sent everybody a margarita and chips and salsa, and we had an HR happy hour, right? And they were so excited about that. Wasn't really a big thing on my end, but it really made an impression on them and kind of, broke the routine a bit. Resist the urge to micromanage. A lot of managers feel like I can't see them, I can't see what they're doing, and so be careful about that. And then celebrate successes, successes of your employees, successes of your clients, whatever successes you can have, because we got a lot of bad news going on right now. It's always it's always good to have a little good news. Okay, telecommuting and ergonomics. So we have to remind employees, even though they're working at home, they should treat work like work, right? Set up a proper workstation, a proper chair. I was on a Zoom call yesterday, and one of the people was actually working from her bed, just like this picture. And I really had the urge to say, that's not very good from an ergonomic standpoint. But so we do want to make sure employees are set themselves up properly. And if you need to be able to train them and talk about what that looks like with their keyboard and their mouse and their monitor and their chair, then you should do some training and talk to them about that. Okay, a couple things to be careful about when it comes to remote workers. There are minimum wage ordinances in many cities and counties across California: San Diego, LA City, LA County, Santa Monica, Berkeley, many of the cities up in Northern California. If your remote worker works in one of those minimum wage ordinance cities, then you have to pay them the minimum wage on where they're working. It's not where you're located, it's where the worker's working. So that's something to be cautious about. A lot of these minimum wage ordinances also have a local paid sick leave law. So in that scenario, you might owe them more paid sick leave as well. So that's something to be aware of. The other issue is expenses. Do I have to pay their internet? Do I have to pay their cell phone now? Do I have to pay to provide them a printer or ink because they're working from home? And the short answer is yes. California Labor Code requires employers to indemnify and reimburse employees for all necessary and reasonable expenses that they incur in order to get their job done. So generally what we recommend when it comes to, let's say, cell phone use or internet use is when they're working remotely, they're probably using their cell phone and or home internet about 50% of the time. So I generally say provide a 50% allowance of what might be typical or standard. So generally anywhere from 50% is generally anywhere from $25 to $30 to $40 a month per person per employee. And what I would do is say, here's what I'm providing you. If you find that that does not cover your expenses, at any time you have to let us know so that we can make sure that we put a policy in place that does cover them. Okay, COVID-19 workers' comp. So As we learned on May 6th, Governor Newsom issued an executive order that granted a time-limited rebuttable presumption that anyone who contracted COVID at work and had worked within 14 days of getting a positive test, it was a rebuttable presumption that they got COVID at work and could file a workers' comp claim. That sounds really scary. Well, the good news is this ends July 5th. It ends next week, unless it gets extended, which could happen. I haven't heard yet that it will, but it could happen. So what's happened is anybody who's gotten COVID who has worked in 14 days, we've had to provide them a DWC-1 form in order to file a workers' comp claim. You as the employer can rebut that presumption and try to have the claim denied based on it being investigated. What would be a rebuttable? What would be rebuttable? Well, let's say I have 20 workers in the same workplace, but only one's gotten the virus. I could probably say they didn't get it here because no one else has it, right? That might be a rebuttable presumption. You might be able to point to the safety measures that you're doing, what PPE you provided, and any correlation to medical condition. The really downside of this, unfortunately, is that they are not giving employers any breaks with their mod rate under this, even though they've created this required workers' comp order. Okay. Okay, OSHA has required that your IIPP, your Injury and Illness Prevention Program, which is required to have a written program for all employers with 10 or more employees, doesn't matter if you're a nonprofit or for-profit, that you also include now a COVID-19 supplement to your IIPP. Essentially what you're doing to keep your workplace safe and prevent the spread of COVID in the workplace. So you would outline what your infection prevention measures are and what employee training you're providing, what PPE you've provided, etc. So very important that you have that. And I've already found out that they are, OSHA has been checking on companies to see that they have that they're providing a safe workplace and that they have updated their IPP with the supplement. So very important that you put that in place. For a lot of companies, your workers' compensation company might provide that. So you might want to check with whoever your work comp insurer is and see if they would help you with that. Okay, PPP. Nonprofits got PPP, right? Okay. So what to do if your offer is rejected? Well, the rules have relaxed a little bit when it comes to the PPP, and the SBA has said that you will not get penalized if you offer to rehire employees and they refuse your offer, but you do need to meet 5 conditions. Clearly present the offer in writing, offer the same salary, wages, and number of hours the employee had prior to the layoff, get a rejection of the offer in writing, put all of that together in a file with your PPP forgiveness file, and that would be submitted then when you, and that won't count against you when it comes to the payroll number or the headcount number that they're requiring on the forgiveness side. Now they did change the forgiveness from 75% of payroll to 60% of payroll. So, and they also created a much longer lag time. Actually, it's on the next slide. So extension of time to spend your PPP. There was a reduction in mandatory spending on payroll from 75 to 60%. Extension of time to repay the PPP. Extension of time to rehire the workers. You had till, I think, till the end of the year. There's a safe harbor extension, a safe harbor clause for rehiring workers, and extension of time for when you have to start repaying it, and a deferral of payroll taxes. If you got a PPP loan, please make sure you've talked to your accountant or your tax advisor, because there are very specific things with how this is handled. And I don't want to see anybody not get the forgiveness portion because they didn't set it up properly. So make sure you talk to them. Okay, we're going to switch gears a little bit now. We're going to talk about the other big issue that's going on that we're dealing with, and that is the issue of racism. and how to talk to employees about racism. First of all, one thing we do recommend is don't try to hide from this, because it's concerning employees, it's out there. They may even actively be protesting around it. But whatever you do, be authentic. Employees can see right through it if you're not authentic. Don't try to shrink away from it because you're out of your depth. Get some knowledge, education, and think about it first before you start speaking to employees if it's something you're not 100% comfortable with. Well, you want to put some safe avenues in place for people of color to be able to give honest feedback about their own experiences. But be sensitive that some people of color may not be comfortable discussing race with you. You might feel like, I want to open this up. I want people to express themselves and talk about their feelings, but not everyone is necessarily going to be comfortable with that. And first and foremost, please don't talk to employees if you haven't been walking the walk, because nothing is more inauthentic than that. Employees will see right through it, and you've lost your credibility around this issue. And I will tell you, I have had a lot of business owners and executive directors, heads of organizations who haven't walked their talk, and it's actually going to backfire against you if that's the case. Okay, if you have it and you're willing to acknowledge it and recognize it, then that's even better. But make sure you're not not doing that. If you're part of the problem, come up with a plan to fix it. Okay, tips for discussing racial injustice. I'm going to kind of focus on the right side of this slide. You could always ask employees what the company could do better to address racism. And if you do ask that question, try not to be, you might feel like, I want to defend that because that's not true, or it's not that way. Be really careful. When you ask people for feedback, it's really important that you don't judge the feedback that they're giving. But we want to hear from a perspective of employees what their own experiences have been. Ask them if they feel leadership has been exhibiting any racist behaviors, and if there's any business practices that they feel contributes to racist behaviors or attitudes, and just make sure that they feel talking about race is a safe subject at work. Okay, so when it comes to dealing with racism, you want to have a clear policy. And our suggestion is not just the head of the organization sign off on it, but the entire executive team. Then it really sends a message that this is who we are. Identify racist practices and try to have a corrective system to correct them, just like you would if there was harassment going on, right? We have a system in place to identify any harassing issues and a corrective active system to correct them. We want to create a safe and healthy work environment for our employees. Should you have an issue of racism, make sure you document any incident, that we tell employees any racist incidents are reported to supervisors, and you could file a formal complaint. So we would deal with an issue of racism just like we would deal with an issue of harassment in the workplace. Okay, don't discriminate. So certainly fear is kind of a normal reaction in times of uncertainty, and sometimes people express fear in different ways. They may express it as anger, they may withdraw, but people do have a lot of concerns and fears. It's a very uncertain time, so be careful, be kind, don't discriminate because of your own fears, right? So right now, we hear things about COVID virus and where it came from and who brought it here. And I really do think that a lot of that is out of people's fears because they don't know. Don't discriminate against people who you think may have coronavirus, and understand coronavirus has impacted every single country in the whole entire world at this point. So we can't necessarily attribute it to any specific group. Let's talk about some things about stress, anxiety, burnout, all the things that are kind of impacting our psyche right now as we're dealing with all these issues, right? So what is burnout? It's a syndrome that's conceptualized from chronic workplace stress that just hasn't been successfully managed, right? So what can we do about the feelings of burnout? Well, we should ask employees, talk to their manager, let them know how you're utilize your EAP, your employee assistance program, if you have one. Talk to other coworkers, because you're probably not alone, right? Especially if you've got everybody working remotely right now. It's very possible that you think, I'm just feeling like this, no one else is, but everyone else is feeling this way. And then implementing healthy stress mechanisms. So, you know, they tell you in order to prevent burnout from working from home, create a one of the things that seems to be happening with remote employees is they don't know when to stop the workday, and they end up working well beyond what would be their normal work hours. So they have to create a schedule, plan and prioritize, create a separate workplace so that they go to work and leave work. Taking breaks throughout the day, trying to maintain a good attitude, asking for help when you need it. So again, finding ways to communicate with your staff is really, really important right now. Okay, so what are some strategies for self-care and stress and anxiety? And again, a schedule. Try to get up and go to bed the same time every day. Take a shower every day. Might sound silly, but it actually can really make you kind of feel like you are creating some semblance of normality within your day. Eating healthy meals at regular times, exercising regularly, allocating time between work and time for rest, and again, making sure your employees are putting the work down at some point when they should, and then taking time to enjoy things they enjoy, and mostly, and again, minimize news feeds, because you could sit there and watch the news all day and almost be traumatized by the end of the day with the way the news is portrayed. And lastly, you know, be gentle on yourself. Give yourself a break. We like to remind people to keep the big picture in mind. This is highly unusual time. We've probably never been through anything like this in our lives, and hopefully after this is over, won't again. But this is really a season. It will pass. It may be difficult. It's kind of scary of how do we get from point A to point B. But the most important thing to keep in mind is point B does exist. We're going to get there. And every day gets us a day closer to point B, right? So let yourself off the hook. Create your own safe harbors. Take a break. Try to stay healthy. Mindfulness and acceptance. You know, do yoga. Do do meditation. Read a book. Take up some things that you've been wanting to do that maybe you've just not had the time, but now you do. And mostly take a step back and slow down where you can. Okay, so there we go. That's our presentation for today. We ended 1 hour, 11 minutes. So we're a few minutes ahead of the schedule.
Good work, Audrianne. Thank you very much for this. We have a question on the board that's from Marguerite.
Okay.
And the question is, are there any circumstances where an employer would be exempt from FFCRA?
There is. There's a small business exception. So for employers with 25 or less employees. So they had originally put out how you had to ask for that exception. I think, and I don't know that that's been updated. I do believe that if you can show that it's a hardship on you as a business, you can take that exception. But again, remembering that you're able to get reimbursed for your FFCRA monies almost immediately. So you'd really have to show that you're unable to even be able to provide that you just don't have the funds to be able to provide that, even with the immediate reimbursement, and be able to show, if you were kind of called on it, so to speak, that it's a hardship and you couldn't do it. So right now there's no one kind of knocking on your door, or nothing you have to submit for the hardship. But if you were called to prove it, you'd have to show it.
Okay, there are no other questions. Any last words that you'd like to share with the audience?
Just that, you know, it is an unusual time. Let common sense prevail. The answer isn't always out there. I know a lot of our clients will often want us to have the answer, and the answer just may not be available sometimes, because we are in new territory that none of us have ever been in before. Kind of use common sense and give yourself a break, and we will get through this.
Thank you, Audrianne. So this completes the webinar. Before you sign off, we would greatly appreciate it if you took 1 minute to respond to a very short survey to help us improve our service to you. Something will pop out once you sign off the webinar. Well, this is the end of the webinar. Bye-bye. Audrianne, thank you for doing this.
Thank you very much.